Do I have them all? Let's go over this. I did have some extra copies. I'm not sure why I made some copies. But anyway, what's the intervascular layer covering the inner lids and the sclerocal? What's that called? It's called a conjunctiva. And what's the most common cause of inflammation of this layer?
Allergy.
It's allergies in the next.
Virus.
But everybody wants a what? Everybody does. Okay. But anyway, and sometimes prophylactically is maybe not a bad idea. But okay. So the number one cause of blindness in the world today is chlamydia trachomatis. But this is not in this country, is it? But why isn't it still in this country? The number one cause of blindness. The eye drops at birth. The drops of erythromycin, it's usually erythromycin, at birth. So, but in our country, you know, we see macular degeneration, we see aging-related types of causes for blindness, but in the world today, still chlamydia is so great. Tinea pedis is more commonly called athlete's foot, right? Named the etiology of shingles. We had that presentation. What is that? Varicella zoster. And named the etiology of gangrene, Clostridium perfringens. And how is the hyperbaric chamber effective treatment for gangrene? How is that? So it's saturated with oxygen, which is oxygen is toxic to Clostridium perfringens because y'all know it's anaerobic. So oxygen's a great treatment for that. What's the name of the distinctive rash that may be present in some cases of meningitis? And in other cases, it's not just in meningitis, it's in other things too. But what do we call that rash where you see those little hemorrhaging under the skin, little tiny petechiae? Yeah, petechial rashes. They're referred to as petechial rashes or petechiae. What condition has been associated with acanthamoeba that we've discussed? Keratitis. Right? Coccidioidomycosis is commonly referred to, it's coccidioides immitis. It's called what fever? Valley fever, right? Okay, so were they fair? Okay. Cryptococcus neoformans may cause meningitis in immunocompromised patients. And it is a fungus. That's how you have to, that's a whole final exam, which y'all just did right there, right? For all the microorganisms, know their name, what they cause, what group they're in, right? Okay. So thanks for playing. How did you do? Remember, some quizzes get dropped. Yet to be determined how many, but some quizzes get dropped. These lecture quizzes are for you to know how hard you need to study in the next 10 days. Are we that close to finishing, really?
When is the test again?
When is the test? 29th. It's the 29th, right? What did I tell you all?
The final exam is the 29th, and the test we haven't made up yet.
The final test is the 29th.
And you can take the final exam.
Yeah, you're right.
Take the final exam, then if you want to, like take a break.
Or
You
take
come
it
back
on
in
the
here and
first.
take the final exam on the 29th and be done. Or you can wait until when? May
Make sure.
6th. Okay, so did I say the first?
You said the first, and
I
then
said the
the
first. Okay.
And the 6th.
and the
Okay.
6th,
All
is
right,
if you want
okay. Whatever I said. Go. Yes.
Okay, so like for your AMP people, can like we come in and take our AMP final exam and then right after that take micro? So
I mean, if you would want to do that, you could.
like if we only wanted to do it one day instead of having to wait till like 12 o'clock. Could we
Yes.
just take it like
Yes.
that? Okay.
Yeah, you could do that. Bless your hearts if you decide to do that. But yes, you could do that. All right, so Molly is going to go. Did I start the recorder? I think I did, but just did I? You did. Okay. All right. So thank you, Molly.
Okay, so I'm going to tell y'all a little bit about myself first. This is IgG4RD,
And this wasn't on the list, but this autoimmune disease has affected like my family personally, so I figured I could like spread some knowledge with y'all. This is a very rare disease, and my grandfather actually has it. And whenever he got it, there was only 54 documented cases in the United States, and he had it. They discovered that he had it in 2014, and for about 2 years, he was in and out of the hospital. We spent Thanksgiving in the hospital, Christmas, New Year's of 2014 in the hospital, just trying to get him back, like level, normal, and everything. So here's my papa. This is me. He's a very sweet man. He's give you the shirt off his back. And this is him in the hospital. That's my nanny in the bed with him, and this is some of my family members. It was very, very hard, like, on us as a family, and I'm from Louisiana, so everybody in Louisiana does oil field or dispatch or something like that, like boat docks and stuff like that, shrimping boats. And so my papa, along with my dad, my other grandpa, my brother, they worked in the oil field. And so my papa worked from, I think, like 17 or 18 all the way up to when he got sick. And he was like the breadwinner, and, you know, my nanny didn't really have to work. And so whenever he got sick, he became completely disabled. He couldn't work. So that was like a really hard adjustment for him as the man to not be able to bring money and provide for his family. And this is my papa again. And this picture is my nanny and my papa. And we had actually just visited. I moved up here about 3 years ago, and in 2016, and then in November of 2016, we went down to visit, and this was us right before we left. So this is my nanny, and this is my papa. Okay, so what is IgG4-RD? So it's a chronic autoimmune inflammatory condition characterized by tissue infiltration with lymphocytes and IgG4 secreting plasma cells, various degrees of fibrosis, which is scarring, and a usually prompt response to oral steroids. So as soon as they found out that he had it, he immediately got on steroids, and he started off with 60 milligrams of steroids 2 or 3 times a day. And if y'all don't know, steroids like have really bad side effects, like they harm your body. And the doctor told him if the disease didn't kill him, the amount of steroids he was taking would, because it was like such a high amount, and you know the average person isn't supposed to take that much. And I'm sure everybody does know what autoimmune disease is, but it's where your body attacks itself. And there's currently no cure for this disease. You can only treat the symptoms with, you know, any autoimmune disease. What does IgG4-RD stand for? So in this case, it's an immunoglobulin G stage 4 related kidney disease. As Ms. Back said a couple weeks ago, IgG is one of the most important antibodies that we have, and it attacks pathogens, viruses, bacteria to keep us from getting sick. And it's recently recognized a systemic inflammatory disorder that can affect most organs, tissues, such as sarcoidosis. The kidney is a frequently affected organ with, I'm sorry, I have a trouble saying this.
That's okay. We're reading it.
Okay.
Interstitial nephritis, really, essentially.
And that's just basically it attacks the kidneys. That's what it's saying, is it attacks the kidneys. And sarcoidosis is an inflammatory disease that affects multiple organs in the body, but mostly the lungs and lymph glands.
Did he have sarcoidosis too?
Mm-hmm. Yeah. And the importance of IgG, as Ms. Back explained, it's a very crucial antibody that everybody has in their body, and it attacks viruses, pathogens, and the plasma cells turn into the antibodies which attack. They make them. Okay, yeah. And it's the main type of antibody found in the blood and extracellular fluid, allowing it to control infection of body tissues by binding many kinds of pathogens such as viruses, bacteria, and fungi. IgG protects the body from infection. So it's, you know, very crucial for, you know, your survival, as in building up immunity to sickness. Like when you get vaccinations, it builds up your immunity to that, to not get sick again. What are the symptoms of this autoimmune disease? So there wasn't a whole lot of stuff on like the internet and like medical websites because there hasn't been a lot of research done for this. And so the things that I've seen, all the research has been in Japan. You know, obviously we're not in Japan, but this is what I found. And this still goes along with the US because the most people that are affected are like middle-aged older men, and my grandfather is a middle-aged older man. And it says they have only mild or no symptoms. And my grandfather, the way he found out, his urination was off, like he would have blood, or sometimes he couldn't go at all. Even if he drank like an excess amount of water or fluids, he couldn't go to the bathroom, or sometimes it would be like an excess amount, and it was just never like a happy medium. It was always one extreme to the next. And the results of the disease, so he actually found out that he had it. He went to so many doctors for so many different things. He actually got his prostate removed, he got his thyroid removed, and he got parts of his lymph nodes. Like he got lymph nodes removed, not all of them, but some of them. And so
Is it his thyroid or his thymus? I'm sorry.
No, it was his thyroid.
It was his thyroid. Sometimes they'll remove the thymus.
Yes, no, it was his thyroid. And of course, whenever like the thyroid and prostate, the lymph nodes, they play a crucial part in, you know, hormones and everything, trying to balance your body out. And so since he got that removed, he had to go on more medication to keep a happy medium, to keep his body functioning and everything. And of course, all medicines have side effects. So he has developed more, not really illnesses, but more things have come up because he's on the medicine, and his body can't like just do everything like it should. And so he was on peritoneal dialysis along with hemodialysis. So whenever he found out he had it, you know, stubborn old men don't want to go to the hospital. They'll be fine. Don't take them to the doctor. Well, he said he would like taste blood in the back of his mouth. And so my mom, she went to nursing school, and she was like, this isn't normal. You need to go to the doctor. So she took him to the doctor, and his blood pressure was like 260 over, I think like 180. And if anybody knows, that's like really, really, really high. And the doctor said if he would have waited like another day, then he probably would have died. Which, I mean, he didn't, so you know, we're good. But as soon as that happened, they rushed him to the ER, and they figured out, like, they took all kinds of tests and stuff, and they didn't know then what it was, but they put a port in his neck. And a port, it's like immediate access to your bloodstream, and that's when he started dialysis. And the thing, like, I'm not saying doctors are bad, because doctors aren't bad, but he went to went to a urologist. No, they're not. They're really not. But he went to a urologist, and that's when they had like the prostate problems, and they thought that it was just his prostate. And they did test, and they tested his creatinine levels, and your creatinine should be under 1, and his creatinine was 14. And they didn't check his kidney levels or nothing, and that's just kind of like, if they would have told him that, or if they would have, and I mean, they seen that his levels, and if they would have, I don't know, I feel like if they would have took more caution to his kidneys rather than his prostate, then they maybe could have caught it sooner. And peritoneal dialysis is when it's in like your stomach area, and it's like tubes, and you connect it to like a big machine every night, and it filters everything out to get all the toxins and stuff out of your blood. Because when your kidneys are failed completely, you can't function, like your kidneys can't function, and they can't get all the toxins and everything out of your bloodstream, and you don't want that in your bloodstream because that can cause many, many problems. He had a port in his neck, and he had a fistula in his left arm. And this is a fistula. He had it in his left arm, and this was when, like, if his peritoneal dialysis wouldn't work, he would go to the hospital, and this is how he would get his dialysis. And this actually got infected many times, and that's like a direct port in, or that's a direct way into his bloodstream. So, you know, if you have an infection, it's very important to get treatment so you don't become septic. So this is the epidemiology of IgG4. A slight predominance for middle age and older males. Individual cases and series have described renal involvement in patients with IgG4RD, and the most common finding is it affects the kidneys, and it affects older men. And not only this, like my grandfather personally, it has attacked his thyroid, which he had removed, and it attacked his prostate, his kidneys, and now, well, he goes to the doctor like 3 or 4 times a month, and he goes to LSUS, which is basically like the Duke of Louisiana. Like, it is an amazing hospital, like big research hospital. It's fantastic. And the way his doctor explained it to our family is his body makes bad antibodies which attack his organs. So instead of attacking like the pathogens, the viruses, bacteria, everything, it attacks his organs. And this is a healthy kidney, and this is a diseased kidney. And his doctor said whenever they took the biopsy that the piece of tissue that they got, and he's been a doctor for like years. He studied it like, I don't know what medical school, but I know, he studied a very good medical school. And he said if he wouldn't have known this was a kidney tissue and he just like came up to it and looked at it, there's no way he would have known that it was kidney tissue because it was so destroyed. And these are the misdiagnoses that he was told, and we actually just talked about this last Monday. How do you say it? Sjogren's syndrome. And Sjogren's and the Zika syndrome, they kind of run like the same, but my papa, they said he does have Zika syndrome, but he doesn't have Sjogren's. But Sjogren's and Zika's are like hand in hand, so I don't know about that. And the thyroid disorder, they said that that's what it was at first, and so that's why they removed it. And then the prostate problems, they didn't realize that it was his kidney that, couldn't filter out, and that's why he wasn't using the bathroom, and so that's why they took the prostate out first before they knew the cause of why he was having all these problems. Okay, the review questions. What does IG stand for? Yeah, good job. What does autoimmune mean? Yeah, good job. Is there a cure for this autoimmune disease? And then this is pictures. This is me. This is my boyfriend. That's my nanny. That's my papa. And then that's my brother. And this is when we came and visited for Thanksgiving. And like my brother and my papa's like a dad figure to my brother. Like, he's always been there. And I'm not saying my dad hasn't, but my dad worked away 2 weeks like at a time because he worked in the oil field. And so my papa was really like the father figure for my dad. And whenever he got sick, and I remember this one time we were at the hospital, and they have 5 grandkids, and so we all came to the hospital, and they like made us take pictures with him because they thought like he was about to die. Yeah, they thought he was going to die.
So it's 16 since 6 to 3 years.
Wait, yeah, no, it started in 14.
14.
Mm-hmm.
So he's
yeah, oh, he's doing better.
Yeah, because this was really serious, and I know it's frustrating when people get misdiagnosis in the beginning, but these diagnoses can be so incredibly complicated.
Yes.
And almost all autoimmune diseases, sometimes they're not isolated, they're not alone, so you have others with them, and it can take a long time to get to the diagnosis. It's very frustrating, and it's got to be for family members.
Yes, ma'am.
And especially when it's so aggressive.
Yes, ma'am.
That you're close to losing your person, and so thank you for sharing that. I appreciate it. Have they linked this to any environmental exposures?
No, ma'am.
They haven't. So you haven't heard that, because we do think autoimmune diseases are because of environmental exposures, and I would think with your dad, he's probably been your granddad, he's been exposed to a lot of stuff.
And they his dad had Alzheimer's, and he passed when he was like real. So
you don't know if
I don't. They don't know about anything like that. And this was them in the hospital. That's my mom, my nanny, and my papa. And anytime, like,
sorry, I didn't know you were not finished. I came up because I thought we were.
No, it's fine. So even when they went home and they did like the peritoneal dialysis, you have to like make sure everything is very sterile. You have to dress it properly. And so, I mean, I'm not going to say it was hard on my nanny, but in
very
a way,
hard.
yeah, in a way, yeah, it
Yeah.
was. And like you're having to adapt your whole lifestyle. And he was like the man of the house. He did all the hard work. I mean, it's not really hard mowing lawn, but you know, you just have to be careful with what you do, how much you lift. And it was just a really hard adjustment for them. But from the medicines, he has like developed Parkinson's, and so he gets so frustrated because he'll try to eat and he just shakes and the food just falls off, and he gets so frustrated. I mean, it breaks my heart. I mean, he's just such a great person, and just to see him like, you know, sick and stuff. But I mean, he has gotten a lot better, and they're dealing with it day by day. And yeah.
I'm glad he's still with us.
Me
Thank you
too.
for sharing that, because you know, this is important for us to realize people aren't just one disease, are they? This is such a great example of that. People aren't just one infection, and they're not just one disease. They have a whole thing. Thank you, Mom.
You're welcome. Thank y'all.
Okay, who's next? Okay, thank you.
So how do you
So actually, let me see. I think that if this just comes up like you already closed it.
Yes, ma'am, I
So
closed it.
I think you can probably just go ahead and
Do you
can
have
pull
to
that out.
like safe eject it though?
I don't think so.
Okay, so I can just pull it out?
I think so.
Okay.
I would, but you
Okay.
know, I'm not the best
Wait.
one to. Can we just wait till the end and you can get it before you leave, just in case?
Yeah, but maybe she has to put hers in?
No.
Okay. Oh, okay. Yeah, I'll get it.
Okay, so you can step here or you can sit down. Okay, good.
I didn't make it clear.
Down at the bottom, there should be like look like a TV screen. Bottom.
Do you want me
right
to do
corner.
that? I'll do that. Okay. See, I love it when I can do things that young people might not. So this is the action.
Oh, no, no, sure.
So you can either you can either do that and enhance it, or this little secondary. Okay. All right. Okay. Are you fine?
All right, thank you, Abigail. Next, Abigail's up.
All right, so heads up, I'm really nervous, so bear with me. So my name's Abigail, Abby for short, and I did measles with no vaccine, so the unvaccinated children. This is Belle. All right, so for my case study, there was a newly graduated nurse and a 6-year-old boy, his name's Dale, came into the hospital with his mother, and he had, how his mother described it, was a bad cold. Well, he had a high fever, sore throat, he was coughing, had an elevated heart rate, and a rash, as his mom said, all over his body. It was the middle of winter when this came in, and he was covered in clothes, so the doctor couldn't actually tell. He just noticed it was on his face and his neck. And he also had a headache, which that comes into play later. And they took him back, and the nurse did a head-to-toe assessment and discovered the rash literally covered him from head to his toes. And the nurse has never seen anything like it before. So that's a little picture of what the nurse saw originally, which that can be mistaken as pretty much anything. Well, he called a physician in to assist and asked Dale to open his mouth. I'll explain that because it's not really in here. And asked the mother if he's had any of his immunizations. And she responded no, because it was against her beliefs and everything. So they instantly put Dale into isolation and told his mother that he had measles, and how the doctors told the mom was extremely sassy. There ain't no other way to put it. Because the physician literally looked at the mom and said, well, you should have got your son his immunizations, because now he's got measles, and he probably just infected the entire waiting room. For anyone who hasn't, like, quote unquote, what was in the book. So just to confirm it, they performed a chest x-ray and did blood work to confirm and all that, and they had to inform the state health department. Well, he was actually admitted to the hospital, but not for the measles itself. He was admitted because he also got pneumonia. He had a mild case of it. He was lucky. About after 4 days, he was discharged, and he made a full recovery. The state health department had to notify any family, and come to find out, almost the entire family had the same beliefs as she did. So every child had to go into quarantine at their own home to prevent any spread of it. And yeah. Well, what is measles exactly? It's a virus. It also has another name that it can go by apparently, and I can't pronounce that. Yes. And you can prevent it. A lot of people now prevent it with the MMR vaccine, which is mumps, rubella, mumps, measles, and rubella. Before the vaccine even came out, on average, 385 people died from it daily. And a majority of these were kids. And since the vaccine, those numbers have dropped 74%, which Ms. Becca said. The symptoms usually are sore throat, dry cough, headache, conjunctivitis, and a very high fever. And it's transmitted through respiratory system. So you just breathe out and it's out. It's actually considered one of the most contagious diseases. Well, illnesses. The ELISA test is used to diagnose, which is just test the IgM antibodies if you have it in your system, yeah. And all you can really do is treat the symptoms. Nothing really else. And you have to isolate until it goes away.
And you hear that test called the ELISA test. Yeah, they call it ELISA.
I didn't
hear
know.
about it a lot.
Yeah. I didn't know if you said it like Eliza.
But, I know, but they do call it, and I'm glad you said that because y'all will hear that in a hospital here.
Yeah.
And it is just called the ELISA test. It's a pretty rapid test. You get the results quickly.
See, I looked at it at first. I was like, what is this? Until I read further on, it said the IgM.
Yeah.
Outbreaks just in 2019. And keep in mind, it's only April. There's been 555 cases reported in 20 different states. Luckily, Virginia is not one of them. Yeah, not quite. You mostly get it from contracting the virus abroad. So you come to find out the kid had gone abroad recently. So he caught it from somewhere else. And one unvaccinated child passes it to another. But this is actually from the CDC itself. This is since 2010, the amount of cases. So the lowest it has been, it was in 2012, and that was 55, but just in 2014, which is 2 years later, there were 667 cases. And like I said, it's just April, so this number is likely to go up. And this was actually published in March or something like that. So, yeah. All right, so here's my question. What is the vaccine to prevent measles? And which class of antibodies is used to diagnose measles? Yeah. Here's my things. I wish I put a picture on here though, because I found, but I didn't know if I should. It was showing the stomach of one of the children, and his entire stomach was red.
Yeah.
It was
a distinctive rash.
Yeah, and if it gets bad enough, it can pus. And it's really gross. Guys, it's really gross.
And advancing into that pneumonia isn't really uncommon. Luckily, he resolved from the pneumonia, but then the subacute encephalitis, that's how they end up dying, and from complications of pneumonia. Thank you. Who's next? Okay. Do you have a thing? You do. Okay. So we do have to pull that out. Or there's a couple of them, but I think you can just pull one out, can't you?
I think you can. I think you can pull that out. And then just go ahead and look for yours.
Just pull it. Yeah. It's just going to beep at us. That's all it's ever done for me. That's so funny. What'd you say? Oh, okay.
She would be the one to point that out.
He's way up.
Oh, you did the whole time.
I did.
Listen, the president.
I'm not good at spelling.
One of the presidential candidates for the college, there was three that interviewed. They picked 3 out of 80 applicants.
I'm gonna play from the.
I do want to tell you all this. He did not going to be our president.
Right there. Okay, great. I don't want the clicker. I want to see it.
One of his slides had 7 typos.
Probably.
First slide had all caps. You know who else does all caps, right? But anyway,
That's what I want to do.
first slide had all caps.
We'll just lower this. Push the
And
button
this
and
guy,
lower
it
it.
was so embarrassing because
Push the button and lower the
everybody
table
does this.
so you can sit.
Everybody does this. this, but we usually.
Yeah, I want to sit back there and watch it myself. Miss Back, where's the clicker at?
I'm going to get it now.
Yes, she did.
That's what she. I think I was gonna say I think that she went home right after the lecture. She was definitely she had to figure out.
We all recording now.
Oh my gosh. I don't think she listens to him.
Oh my goodness.
Oh yeah, I changed. I had hold in the first one. Okay. I was.
She had nice.
Oh, it's not working.
I got it.
I couldn't concentrate. That's what he was doing.
Okay, so it should be like that. Did it do it yet? Wait a minute. Is it on? You have to turn it. I love this little thing. It was off. Oh, and then it vibrates in your hand. Campylobacter.
Oh, here's your. See, so y'all could sit back at church. Aren't you mad you didn't have a clicker?
I want you to stand up there. I feel so weird.
All right, my name's Amanda, and I had Campylobacter, Listeria, Salmonella, and E. coli.
Fun stuff.
All right, I have the case file. It was only on Campylobacter, but Leona was 88 years old, and she was living in a nursing home, and she had a family reunion coming up, and her extended family from Mexico were coming. And after she attended that, a nurse found her very sick 3 days after she went, and she was vomiting as well as diarrhea, fever. So they called the doctor, and the doctor ordered rehydration as well as stool cultures because it had a distinctive smell. And the doctor questioned Leona about the possible exposure she had had, and if it was the environment, the caregivers, or if she had ate anything different. And the doctor established that the family had brought her food from the reunion. And one of the main things was queso blanco, a Mexican cheese from unpasteurized milk. And Leona's stool culture came back positive for Campylobacter. The family revealed that 2 other people had mild GI symptoms, but dozens of people had eaten the cheese. So, if the source of Campylobacter was indeed the cheese, why did only 3 people get sick? Only because slight symptoms. It only causes slight symptoms in healthy people, but it's more virulent in older people with weakened immune systems. Why is most milk in the United States pasteurized? It greatly reduces the number of infections and diseases transmitted by cow's milk and dairy products like cheese and yogurt and cottage cheese. And it is 150 times greater than the risk of disease from pasteurized milk. So you get really sick if you eat it. This is the most common cause of food poisoning in the United States. It has 1.3 million illnesses per year. It is a bacteria, and the symptoms include diarrhea, nausea, and dehydration. Most people recover without treatment, and antibiotics are only used for high-risk patients, such as older people and people whose immune systems are compromised. And it's also associated with the Guillain-Barré syndrome, which is a rare autoimmune disease, which the person's own immune system damages the nerves, causing muscle weakness and paralysis. God, y'all all looking at me. I'm sitting down. All right, GBS it's not contagious, but it is more common for men and adults 50 and older, and it only affects 1 in 100,000 people. All right, and Listeria. This is a serious infection caused by eating contaminated food with the bacterium Listeria monocytogenes. Okay. Pregnant women are at risk if they eat deli meats and cheeses. Older people and people with a weakened immunity are also at risk. It can cause miscarriages and it can infect the newborn. It starts with flu-like symptoms, and it's diagnosed by bacterial culture. Listeria is treated with antibiotics. In severe cases, it can cause bacterial meningitis, which is inflammation of the brain and spinal cord. This can cause death in a few hours or have permanent disabilities if not treated. And I also had Salmonella typhi. Most people infected by Salmonella develop diarrhea, fever, and abdominal pain, which usually works itself out within 12 to 72 hours. And the infection can last for 4 to 7 days. Most people recover without treatment. Diagnosis is a form of blood or stool sample. You can develop Salmonella from food, animals, and people to people. So it's always important to wash, separate, and cook your food all the way and chill your food in the proper manner. Always be sure to wash your hands after animal contact, because you can also get it from them, like chickens and turtles, yeah. And always be sure to do it after you handle babies' diapers, and if you're helping the elderly, also you're helping change them. And I have Escherichia coli. E. coli is from bacteria found in foods in the intestines of people and animals. Some strands of E. coli can cause diarrhea, and other can cause urinary tract infections, respiratory illness, and pneumonia. Almost 75% of UTIs are caused by this. Symptoms include cramps, diarrhea, vomiting. I've been that twice. Most people are better within 5 to 7 days. And STEC, Shig toxin E. coli strains lead to E. coli. The best way to prevent E. coli is good hand washing, cook your meat all the way, and do not cross-contaminate food areas. Like if you're cutting meat and then you want to cut your vegetables on the same thing, that's disgusting. In case there was any doubt, it's disgusting. And I don't know what answer. What is the most common cause of food poisoning? Campylobacter, and severe causes of listeria can cause meningitis. Almost 75% of UTI are caused by what? E. coli. All right, let's look at this. Thank you. Anybody have any questions? Thank you, Amanda. Who's next?
Amanda, can I just pull this out once I close it?
I've gotten good at pulling that out. Do you want to use this too? Okay. So you can yes, it was that. So it would be this one, I guess. Yep.
I'm Kristen. I had case file chapter 11 on Pseudomonas aeruginosa. In this case file, it's about a little girl named Jaelyn who has vesicuratal reflux, or VUR, and it affects the kidneys, ureters, and your bladder. As a visual, so you have kidneys that produce urine, and then the urine flows down through the ureters, which are the little tubes, and go to your bladder, and then it can be excreted. But if you have VUR, the urine can flow down the ureters and it goes back up, so it refluxes back into the kidneys and causes problems. In Jaelyn's case, she suffered from many kidney infections that led to hospitalization. They diagnosed her when she was 7 months, and by the time she was 5 years old, she had already been in and out of the hospital multiple times. Since her immune system was already compromised because it's fighting UTI infections and kidney infections, she was very susceptible to colds, ear infections, and gastrointestinal viruses. Action against VUR. The first line
of defense, I guess, that you would use would be antibiotic suppression therapy to try to keep the kidney infections down so they won't happen as frequently. But this also compromises your immune system, makes you more susceptible to other sicknesses. Kidney ultrasounds were conducted every 6 months to monitor the kidneys because VOR is more common in children because as you grow, hopefully your ureters will correct the angle on their own so you don't have to have surgery. But surgery is an option and it is a cured thing. So if you have the surgery, your kidneys are good to go. But she had the surgery not because of her kidney infections or UTIs, but because she had a UTI and they did a urine sample and found high titers of Pseudomonas aeruginosa. Pseudomonas aeruginosa, there's a picture of it. I think it's kind of pretty. Yeah.
It's cute. It's like a weird octopus.
Yeah. Yeah. But it's a bacterium that causes UTI infections, swimmer's ear, rashes, gastrointestinal issues. It's an opportunistic pathogen, so it's already in you, on you in most cases, but it's more prone to cause problems if you're immunocompromised like Jaelyn. So being that it was showing up in high titers, it was a risk for her, especially since her immune system was so low because it is resistant to antibiotic treatment. Here's some pictures of stuff that it causes. That's an ear infection. Then it's a burn patient that acquired it. And not every swimmer's ear is going to look like this. This is like worst case scenario. This is what it looks like if you were to put it in a culture. So aeruginosa means copper rust. So if you're in a lab and you do a culture, the one on the right, grapes.
It does.
The colony on the right is a Pseudomonas aeruginosa. For a wrap up, since it is resistant to antibiotics, it was too much of a risk for Jaelyn to have it in her urine sample. So that's why they decided to do surgery because it could have caused life-threatening disease or infection of her kidneys. Questions? What led to the decision to surgically correct the angle, finding high titers of Pseudomonas aeruginosa? A Pseudomonas aeruginosa is what type of pathogen? It is opportunistic pathogen. It's also gram-negative and rod-shaped, but that's just fun facts. Visceral reflux causes what complication in the kidneys? It causes the urine to backflow from the kidneys. And that's it. Do I just pull this out? Do I have to
I
like
think you can close it part yours and then pull it, and I think you can if you just close that. Yeah, just pull it out.
Where do you want me?
Oh, cool.
No, I'm happy the power plan wouldn't work.
So do you want to just put it right, can you put it,
Sure.
or you could just put it up there?
That.
Yep, that, and,
Jenny, you want to hold it?
or Jenna can hold it.
I'll model it,
You can walk it around, Jenna, because it's not, we don't have to see.
Okay,
You
so
have to do that, walking it around.
I have blood cultures, so mine is a little bit different than everyone else's. And a blood culture is a test designed to detect microorganisms in the bloodstream. And my case file, it was a student that was asked to go to the ER to collect blood samples, and the patient had a fever, was not really conscious, and this went on for over a week. He was a 78-year-old male, and he was a diabetic. He was extremely pale, and a urine sample was done beforehand for a urinalysis and culture. And when the student walked in, they talked to him, and he did not even realize that someone was in there with him. So to get a culture, a sample of blood is added to the substance that promotes the growth of a pathogen, and the pathogens are identified using microscopes and testing. And after it's identified, tests will be done to figure out what medication will work. So it's like the sensitivity testing that we did. And 2 or 3 blood samples are taken from different veins to make sure nothing's missed, because it might not be in the system all the way. And on this patient, they did the test for CBC, electrolyte, blood glucose, liver function, and cardiac markers. And they did 2 different sites for the culture. So to get the culture, you'll wrap an elastic band around the upper arm, clean the site with alcohol or iodine, and you will insert the needle in the vein, and you'll attach the tube to fill. Remove the band, put a gauze or cotton ball over the needle site as the needle is removed, and put pressure in the bandage. So the order of draw is really important so you don't cross-contaminate anything. So first off is blood cultures, then the light blue top, red, which is the serum tube, heparin, EDTA, which is the lavender, and then sodium fluoride and potassium, which has the gray top. So the patient was dehydrated, and then they rehydrated him with IV fluids, and it corrected the potassium and sodium levels, and insulin was administered to lower the glucose, and the patient was put on broad spectrum antibiotics. They weren't sure what he had yet. So the results, his hemoglobin and hematocrit levels were elevated, his white blood cell count was elevated, high potassium, low sodium, normal liver function, and cardiac markers. And then there was ketones and protein in his urine, and he had the high glucose. So no bacteria was found in the urine. The blood culture shows the Staphylococcus epidermis.
Epidermis.
And the sensitivity studies were done, and it was resistant to penicillin G, rifampin, yeah, and
Vancomycin.
Yeah, that.
Well, that's ugly.
And the patient had been resistant to the medication they had put him on, so they changed it. And in blood cultures, most bacteria can be seen within 2 to 3 days. So it's like a really long time to wait when someone is in the kind of shape this man is. And he's been like that for over a week. And some funguses can take up to 10 days. Well, no, some bacteria can take up to 10 days, and then some funguses can take up to 30 days to show. So,
Did you get that?
it didn't say.
It didn't say enough. I was wondering. I didn't know if they remember.
We'll just say he got better.
Okay, he's better now.
He's fine and well now. I said,
Thank you. Do y'all have any questions for Casey?
I had a question card, but I'm not really sure where
You're not sure about your question, but it was important that you brought out that when you do blood cultures rather than a regular phlebotomy, it's a very different type of draw. To do blood cultures, it's not usually just cleaning with alcohol. You mentioned the iodine. And if somebody's allergic to the iodine, you have to get there's an alternate thing they do. So it's a much more intense procedure. Every one of us has had blood draws, right? And usually it's the tourniquet and alcohol and ready to go. You do it good, but not blood cultures. It's a different kind of setup, and you do have to do those blood cultures first, because you would every time you would go to do a regular tube, you could potentially contaminate. Staphylococcus epidermidis is part of our normal flora. It's not usually considered to be so virulent. It really isn't. So, but in this man, he was obviously, would you say 78? You got your card?
I found it.
Okay.
So
poor Jenna. Like Jenna's arms must have been so toned.
I love how you're hiding yourself.
She's like so toned with those arms. I would have been like shaking at this point, holding out that long.
So,
Jenna, I think you could put it down. Sorry.
I found my review question. Sorry. So, when is the blood culture drawn? Like, in what order?
Oh, well,
First. And then most bacteria can be seen in the culture in 2 to 3 days. And how many veins are the blood cultures drawn from? 2 to 3.
Thank you. Can I keep that? Yeah. So we can put, if you want to put it up there, we'll just leave it up there. Other people can enjoy that. Who was next?
I think that's all 5.
Was that all for today? Okay, great.
Do you think that's my review question?
Yes, thank you. All right, thank you guys. Appreciate that.
All right. All good stuff. This is all related, you know, to all of this. So you guys, everybody that's mentioned anything today other than the autoimmune, you know, disorder, other than those, these are all on your charts, right? So this is just review for you guys. You had these on your charts. Many of them we've already mentioned. Okay, so where we left off was actually talking about, we were talking about polio, weren't we? Was that one of the last things? Post-polio syndrome, and we know that this is polio is caused by virus, and we hope someday to see it eradicated. Meningoencephalitis, and I think somebody had mentioned about, and maybe it was Amanda, I think, about meningitis, and it said something about inflammation of the brain and spinal cord, but it's really of the meninges, isn't it? But then you can also have meningoencephalitis, which would be inflammation of the meninges and the brain. Yes.
I forgot to say this, but my papa's doctor actually published an article about Meningitis disease.
Really? That's because it is kind of rare, but with Molly saying about this immunoglobulin autoimmune disease being rare, that particular one's rare, but immunoglobulin diseases aren't that rare. So I'm so glad that you brought that to our attention, and just how difficult diagnosis can be. So people should not just treat somebody for their one sign and symptom, should they? Looking at the whole patient. Same thing was brought out with the measles case, and that head-to-toe assessment being so incredibly important. And I think people are busy now, and patients, you have a ton of patients, and people are, they're running through, quickly. Head-to-toe assessments are crucial to do those. So thank you. Anyway, so we're talking about these neurological infectious processes that can happen. So obviously, we don't like to see these because they're all serious. There are two things here that we know. One, these are protozoa. Naegleria fowleri is called that brain-eating amoeba. Have y'all ever heard of that? And it essentially has a 100% mortality rate. There have been rare cases, sort of like that rabies virus, we understand is also essentially 100% fatal. There have been these rare freak things where people have survived, but it is essentially fatal. This protozoa is actually found in all freshwater sources in this local area, in our areas. So mud puddles, ponds, lakes, this is there. This is located there. But what we don't want to see is this perfect storm where you have high numbers of these protozoa due to maybe weather conditions getting warmer. Might we start seeing more of this now that we know we have such crazy weather patterns now and higher temperatures? Probably will. But when that happens and you have a case where a human has gone into the water, like this is why they tell you never dive in lakes or ponds. You should not dive for a lot of reasons. You shouldn't dive because you don't know, you can't see, you might break your neck, okay? But you also shouldn't dive because it forces water into the nose. What are you saying? What you saying?
She does it all the time.
Yeah.
Oh, yeah.
It's because I know how deep they are, though.
I know, but you don't know where the little Naegleria are, and they can be forced into that those cranial nerves into the brain. That's how they would think.
Diving.
Have you never been diving and had water forced into your nose?
No.
Okay. It's really.
I just know how to dive.
Yeah, I know, but even if you know how to dive, sometimes, and let me tell you, those of you who ski, and you've ever done any serious skiing, if you haven't fallen where water has been forced in your nose, you didn't really ski. Which is actually or two. Because I'm a good skier and I rarely fall, but also crazy people drive a boat sometimes, and that's their whole goal is to see what they can do to you.
You mean water skiing?
So you can get water forced up your nose. So this is how we know these cases happen. One of the last cases that was local that happened, the little boy died. He was actually skating on his street. But there had been a recent, heavy rain thing. Water was in the storm drains on his street. And so obviously, that's fun, digging in those too, right? When you're skating. But it was enough water that had gotten on. That's where he had gotten this. Acanthamoeba we've already talked about causing keratitis, but it can also invade into the brain tissues. So these are just ones I hope
that you'll remember they're on your charts, and you've heard me say them out loud, haven't you? And so we can go down through here, and y'all, there's a lot more that you can look at. I think we have a presentation that's going to be on that. Arboviruses. So for like acute encephalitis, so obviously signs and symptoms come on quickly with this, so inflammation of the brain. These arboviruses are called that because they're arthropod borne. That's where the AR and the BO, arthropod borne viruses, meaning that you're usually going to be exposed to some mosquitoes or some other arthropods that are going to transmit these particular diseases. They're almost all acute encephalitis are from there, such as West Nile virus. We haven't heard as much about that recently as we, some years we hear really high numbers of cases of that, sort of like we're hearing now with measles. So it seems to be very cyclic, which actually, again, probably has a lot to do with weather conditions, doesn't it? Herpes can actually cause encephalitis. So we said, just like y'all are hearing, anybody that's immunocompromised, so little babies or people who have AIDS or people who are in end-stage cancer, these are going to be the most susceptible to common herpes viruses invading into the central nervous system tissue. They're going to be the cases, and a lot of times this ends up being, West Nile doesn't end up being fatal, but like herpes encephalitis can. So there can also be bacteria that also cause that too. Jared, did you have your hand up?
No. Sure.
So y'all would want to know what arboviruses are referring to. These viruses that are arthropod-borne viruses. So what might be a way we can manage them? What might be a way?
Get rid of the bugs.
Get rid of, wear repellents. So, wear long sleeves, just kind of protect yourself. We do think about that. Is it possible to get rid of arthropods in our environment? No, they way outnumber us. So no, it's not impossible to, but maybe just using kind of common sense approaches. Are there risks to pesticides? Yeah, so there's risks to that too. Anyway, you can't be afraid to live in the world. Play in the mud puddles, okay? Play in the mud puddles, it's all right. These are some of the arboviruses that can cause encephalitis. I think I might have listed some in your chart, but that would be all you would be responsible for. I want you to just have heard of them. There's also something called the JC virus. This was actually named after a patient, before HIPAA laws. No, but actually kind of, it was his initials, this initial patient and I don't know if I have that on your list, do I? It is?
Yep.
Okay then.
Second from the bottom.
And what exactly does it say there? Where is it? Okay. Chris is saying that you actually believe it is. Okay. But anyway, I mostly just want you guys to get introduced to them. And we are moving on along. I want you to know about Toxoplasma gondii. Toxoplasma gondii is, again, going to be a protozoa. This is something that most of us have been, we didn't have encephalitis, by the way, but we have antibodies against it because we've been exposed to it. This is actually one, now please understand, most people have had this when they were little kids, but it never developed into this, right? So we understand that we have these things. This is the one we worry about though with women who are pregnant. Because if they get exposed to Toxoplasma gondii, then what can happen is this can actually cause spontaneous abortions, and it's very teratogenic. Even if it doesn't cause a spontaneous abortion, it can lead to very severe consequences of a developing fetus. So this is why they tell women when they go in for that first prenatal visit, don't clean cat litter boxes. Don't keep clean bird cages, because this is really in high numbers in those cages, in those boxes. And most of them really don't even handle kittens. That would be sad, because cats scratch and they cover their feces, and it can be under their nails and stuff. So you should really kind of stay away while you're pregnant. Stay away from your pets. No.
But most of us have actually been exposed to it, so we've already had a mild case of it. We got over it, we have antibodies, and so it's not going to cause a problem. But for the ones who haven't, it can be very serious. So that's why they tell you that. And anyway, so there's some other things in here. Like I said, most cases are asymptomatic. We've already had it. We've already had antibodies. So the thing to worry about, though, are those pregnant women. So I want to kind of talk about that. All right. Prions. You know about prions? We know prions cause this, are 100% fatal. They cause spongiform encephalitis or encephalopathies, they're called, which literally could be broken down to mean that it turns your brain to what? Sponge. Exactly. It is really, they're usually long and progressing, so it can take up to a decade or more to progress. These diseases, they are considered to be 100% fatal, and this is why we're careful about meat preparation. We're careful about how we butcher. There's another process meat. I didn't want to use the word butcher, but I couldn't think of process. Because you don't want meats that have been contaminated with cerebrospinal fluid or any of the nervous tissue things, because this is how we think some of this can actually be transferred. And so this is a self-replicating protein disease, and y'all have already been kind of introduced to this. We see it in other animals as well, right? Sheep scrappy, it's what this is called the mad cow disease you've heard of. So these are all prion type diseases, and it's a degenerative progressive disease that is fatal. All right, TJP. All right, I'm moving on along. Y'all like how fast I'm talking? Am I talking too fast? Rabies, we know is from what? Virus. It's a virus. It's from a virus, and we know that, again, mortality rate is essentially fatal. So what we want to do is to make sure that if you're looking for good news, it's slowly progressive. So if somebody's had an exposure and it's just making, they know they've had a potential exposure, they can get both a vaccine and they can get immunoglobulin, and they will get both, right? So this is going to be what happens with this. This is endemic, so it is in our animal populations. If you see any animals that are acting strangely, like nocturnal creatures, and you see them during the day, guess what? That's strange behavior, isn't it? So stay away from it. It can actually be transferred, even if there hasn't been a bite. Please be aware of that. We know that has happened in the past. What'd you say?
It could be like saliva.
Yeah, it can just be from contamination that we're handling an animal. So I know a lot of people who don't mind at all, handling it. Well, they see roadkill or something and they want to move it or do whatever, but people should be very cautious about that. There's certain animals that have higher numbers that this is in. Bats, we know, raccoons, right? But any animal can. And so, just be careful. Yes. Your domesticated animals should all be immunized. Yeah.
I was watching like the game warden show, and this moose, it was like up north, and this moose had something, and it's like whenever they hit it, they just like walk in circles, like they can't, like all the
was that was probably the prion disease. Yeah, that's a prion disease. Whenever you see something like that happening, that could be, but also arboviruses.
That was scary. That thing looked like it was possessed, and then it ran away the next day, and I was actually kind of happy.
Did you see the same show?
No, it was her cat.
No, it was my cat. Like,
your cat.
yeah, and it literally spun around in circles like it was possessed, and you couldn't do nothing. You just had to let it just do what it wanted to do.
Had it had shots?
Yeah.
Okay.
And then it ran away the next day. So.
Around in circles away.
And it's
living
fine in Florida. So we don't think that it's something else.
I'm not going to worry.
Okay, so this is kind of an interesting map because it shows you what predominant animals in different regions. We know raccoons. I remember there was a raccoon out here one day in the parking lot midday, and you would not see that normally, right? So that was of concern, wasn't it? That you see things like that. So skunks, all kinds of these creatures, bats, we know. Yes.
My little sister, she used to be one, and they decided that it was a good idea to traffic him before school. and they put it in the back of a truck, and they brought it to school, and all the kids were out there playing with it.
Okay.
Shoving their hands in the cage and
They
all.
have really wonderful little hands. In case you have never really looked at their hands, they're amazing. But yeah, I wouldn't recommend playing with them. That was really
But the school
irresponsible.
staff left it. And you're not supposed to have them in the cage for 12 hours. And then they caught that thing.
Where were
sometime
the
in
adults?
Oh, you were able to, which you do.
They were supporting it. Is that what you said? Well, okay, there's
They
your
let
sign.
them out.
There's your
Sorry.
sign. What'd you say?
They
Sorry.
let them out as to do this. And you're not supposed to have anything in the trap. You're supposed to check it every 12 hours, I think. But they caught it sometime in the night. But they had it, and then they brought it to school at 8 o'clock. They didn't get out of school till 3.
Okay, that's just cruel and unusual. And whatever. So tell your sister, I said, stop.
My sister did not trap it.
Okay.
She was just playing with it.
Just.
Yeah.
So yeah, so people should just be aware of those kind of things because you know there's issues to that. So just being informed and kind of aware about it. Tetanus, we know about tetanus is caused from a bacteria known as Clostridium tetani is the etiology of tetanus. People call tetanus lockjaw, and I do want you all to know that people call it this lockjaw. And the reason it was called that is because one of the first signs is that the jaw will actually contract and lock down. But then eventually all muscles can, and what can it lead to? Yes, this paralysis, which can lead to respiratory failure because of suffocation. So this, you know, you'll hear about this jaw and you'll hear about this grin that can happen with it. I have never seen an active case of this, and it's probably because of what?
Tetanus shots.
Tetanus shots. So I would want you all to know that the immunizations usually is called DPT, diphtheria, pertussis, and tetanus, DPT. Sometimes they'll take a pertussis component out of it and do a DT because it is, people are sometimes reactive to the pertussis component. But you should all know the guidelines for these boosters because it's slightly different. It's not a typical type of immunization. So what should happen is you should have one every 10 years unless you get challenged. And if it has been more than 5 years since you had your normal booster, let's say you're at your 6th year, and you have a cut, and it doesn't have to be a puncture wound, and it doesn't have to be a rusty nail, it can be a brand new scalpel. But if you have anything that is an injury, a significant injury, you need to then get the booster. So the recommendation is every 10 years unless challenged, and then it's every 5 to make sure you've had it within 5. You get what I'm saying? So that's the regulation, that's the rule, and that's what people should do. In the world today, people are still dying from lockjaw, from tetanus. In the United States, it's usually just a few deaths each year, just that they're not significant. They are, but you know, it's rare. In the United States, because we do, when somebody has a significant injury, it's the first thing they're going to get is a tetanus shot. And this has prevented so many deaths because of this. This microorganism is everywhere, and Clostridium, we know, produces these spores, and they can live through all kinds of situations. So this microorganism is everywhere, and so we understand that. Just like Pseudomonas aeruginosa, that bacteria is kind of everywhere. And so we just have to use smart protocols in trying to prevent some of these things. So spores can enter the body through any of these situations, especially puncture wounds. So we know that because it's an anaerobic organism. So if there's a puncture wound, it's a perfect site. It's happy, right? But it can be from almost any of these others as well. And so people are going to get a tetanus booster if they've had any of those. This is showing you some of that grin I was talking about. Botulism is from Clostridium botulinum, a bacterium. And in this case, instead of a spastic paralysis, you get a flaccid paralysis. Do you think that would be something you need to know? Yes, it is. A flaccid paralysis. I think I told you all I have a son who's doing, he's in Roanoke right now, finishing up program, but they had a baby that had this, that had botulism. And so the antitoxin was out in, the closest antitoxin was out in California. So they had to get it flown in quickly to the NICU for this baby. The baby made it, by the way. But anyway, we rarely see it now because of the regulations of food, our food industry. So, you know, people have these canning procedures that they go through. Y'all have all heard that if you open something and you don't hear that nice click, or if something's bowed up, are you supposed to eat it? No, because Clostridium as a genus, those bacteria like perfringens, tetanus, botulinum, those species of Clostridium, those bacteria produce a lot of gas too. And so that's why you get told that not to eat something if it's a container that's bulging, right? Okay, good. And so we just don't see it as much anymore, but when you do see it, it can be deadly. It's actually considered one of the most deadly exotoxins, is the botulism toxin. Can it be used medicinally? Can it be used medicinally? Yeah, no, it can. Botox, right? That's what Botox is botulinum toxin. And it can be given locally in certain regions to literally paralyze those areas. It's been used effectively for migraines and what else? Some other GI types of issues. Some things. We're going to be out in just a minute. Sorry. What's that word? No. Okay. I'm taking a little bit extra. So anyway, botulism. So these are, I hope you all are becoming, these names are becoming now part of your friends, you know, right? Yeah, so, okay. All right, and the recovery can take some time. So, great. Now, I wanted to see one other thing. Let me see something. Wait a minute, we're not finished. We're not finished yet. We aren't finished yet. I know y'all thought we were. But we're, okay, guys, so are you noticing that we're following, we're looking at our charts, right? Guys, I instead of like trying to rush some of this other stuff, I really don't want to rush it. But next week, what we're going to have to do, just because people are presenting, and we're going to have to use our lecture and our lab time next week, okay? But what we'll probably have to do is move to the lab, but we'll continue on. You will notice that these follow right along with your case files, don't they? They're just talking about these organisms again. If you all wait until the night before, 2 nights before, to think you're going to get this chart, let me say this to you guys. I won't take it out, but y'all's chart, you know what I mean? They have to do this final as a proctored final in my online classes as well. So y'all aren't the only ones that are suffering through this. My online people have to do this too. And the first 2 people who took it got like less than, they could have guessed and got more. Jay, don't laugh at that because that hurts my feelings. Guess what? It's no, it does hurt my feelings because I guess when I gave them this in my online class, back when I gave you all, like they've had this for so long. Guess when I told them that this would be their, if they just studied this is their final exam. The same day I gave it to them. Guess how many emails they've gotten about it? An announcement. Several. So here's, and I had somebody the other day ask me, where was this? Right? So that's fine. I said, no, but here's the thing. If you think you can wait till the last, you can't. Like I'm telling y'all now, just to let you know that don't let that happen to you. Don't let it happen to you. If you had this and you saw that, if it were open book, you think this is easy peasy, it's right off in here, right? But it's not open book. So that means you need to know it. But if you wait till last minute, you are going to be doomed. I'm telling you. And the online people have to take it proctored, and it's not open book either, which is they have to come into the learning center and take it with no notes, no books. So y'all are the only ones. Please, I'm just encouraging. I'm not threatening. I'm just telling you, please start studying it now. Okay, start. But let's leave it here. Leave it so people can see. Do you not want to? No. Leave it up. Leave it up. Do you need a copy of our need that, but I appreciate that. Yes, and so I will put up
So that's like a lot of information.
what? Okay, now Molly's presentation will not be on the text because it was different, wasn't infectious diseases, right? But it's so interesting. Thank you.
So I saw the thing, I forgot to tell you the thing when I first started, 100.
Okay, all right then.
That's sad.
That wasn't counted against you, but I will
Okay.
I will definitely